Good evening, sir.
Good evening, Muhammad. How are you?
Why, thank you, sir. Dr. Aziz, basically, let's ask, what is the interventional cardiology?
Right. So, Muhammad, interventional cardiology is all about dealing with problems with the heart, like heart attacks, blockages in the coronary arteries or valves, and then opening up these things by means of simple techniques. Rather than having to open the entire chest and doing a surgery, it's done via a hand or the leg, and so then it becomes easier for the patient to walk out of the hospital.
Okay. So during the heart attack, what's the procedure? Can you just let us more?
Yeah, so we have been dealing with heart attack patients here in Bahrain Specialist Hospital for almost 5 years. So the most important thing is for the patient to come to the hospital as quickly as possible. Once the patient comes to the hospital, we activate the cath lab team. And within about 10-15 minutes, the entire team is assembled in the hospital. And within about 30 minutes, the patient is taken to the cath lab. In the cath lab is a place where we do the angiograms, the angioplasties, called qastara in Arabic. So what we are going to do there is, patient is going to be awake. We don't put him to sleep. He's going to be awake. We do it from the hand. A small incision is made in the hand, about a 2 millimeter, just a 2 millimeter incision is made in the hand. Through that, we put a small sheath, about again a 2 millimeter sheath that goes into the radial artery. This artery connects to the heart. So from that, we pass a wire directly to the heart. And over the wire, we pass a small tube, it's called a catheter. The tube goes and sits in the coronary arteries, and we inject a special dye. When we inject the dye, the live X-rays are taken so we can see the flow of the dye inside the coronary arteries. We can see if the flow is normal or if there's a blockage. If there's a blockage, then we do open up that blockage.
So is that safe?
It is very safe. Coronary angiography is one of the safest procedures. The risk of complications, I would say, is less than 1%. Of course, when the patient comes with a massive heart attack, the risk is related to the heart attack rather than to the procedure itself.
Okay, that's good. So, sir, can you give us a little bit of advice on how to prevent cardiovascular illnesses?
See, most important is, Muhammad, is like, most important thing is to take care of yourself. Take care of your risk factors. We should know what are the risk factors for heart disease. So the most common risk factors are diabetes, hypertension, high cholesterol levels, smoking. Then there are certain risk factors that you cannot change. These are called non-modifiable risk factors, like your age. So you're more than 55 years of age or more than 60 years of age, you cannot change that. Then your family history. Supposing somebody had a heart attack in the family, if your parents or your siblings had a heart attack, the risk of you having a heart attack goes higher. We cannot change that. But what you can change? We can change the modifiable risk factors, which is diabetes. If you have diabetes, keep it under check with medicines, diet and exercise. If you have high blood pressure, keep it under check. The target is 130 by 80. Try to bring the blood pressure below 130 by 80. Whatever it takes, diet, exercise, medicines, whatever it takes, bring the blood pressure below 130 by 80. Your cholesterol levels, you have to look at the LDL cholesterol. This is the bad cholesterol. So this LDL cholesterol should be brought down to less than 100. And if there is a high risk of heart disease, it should be actually brought down to less than 70. And apart from that, one of the most important risk factors we find in Bahrain is smoking. 1/5 of the population is smoking here. So that's a huge number. All kinds of smoking, be it cigarette, shisha, vape, IQOS, whatever. Yes. The problem with vape, Muhammad, is, for a cigarette, you need to go out of the office. Okay, you light a cigarette, you finish the cigarette, you put it out and you come back. Vape is always in your pocket. You can be smoking much more than what you were smoking with the cigarette. So maybe you end up smoking, the equivalent of 20 or 30 cigarettes a day.
That's the right account.
Yeah, it's a huge one. And what also happens is, vape and other products, in order to make it palatable, appealing to the youth, so they add a lot of flavors, a lot of chemicals are added to this. So we don't know what exactly those chemicals are. We know nicotine is there, but what other chemicals are added, what other flavors are added, and how it interacts with the body, we're not sure. So this also increases the risk of heart attacks.
Oh, that's good. So just a general information for our audience. What is the sign and symptoms of the heart attack?
Yeah. So the most common symptom of a heart attack is chest pain. The chest pain usually is in the center of the chest. It feels like a burden on the chest, like a pressure on the chest, or like a squeezing sensation or a tightness in the chest. This discomfort can be in the center, but it can also be on the left side of the chest, it can be on the right side of the chest, it can go to the left arm, to the right arm, to the jaw, to the back. Sometimes it can be in the stomach area. So any of these areas, chest pain can be there. There can be associated symptoms like shortness of breath. Patient is not able to walk 5 minutes, starts becoming breathless. Unusual sweating. You're sitting in an air-conditioned office and then suddenly you see that you're sweating. Or you start feeling dizzy or unusual vomitings. So these could be the signs and symptoms of an ongoing heart attack.
Okay. So
and also, if I may add, the symptoms may be different in women. In women, the symptoms are much more atypical. You don't see the classical severe crushing chest pain in women. You will see just a little bit of pain here, a little bit of pain there, unusual tiredness or fatigue. These could be the symptoms in women. So whatever, if you feel that if there are any symptoms that are suggestive of a heart attack, but better get yourself checked. One of the common things we also read about is, a feeling of impending doom. Something bad is going to happen to me. You're having chest pain and you start feeling that there's something bad is going to happen to you. That feeling of impending doom, that is also a sign of a heart attack.
Okay, sir. Thank you very much.
All right, Muhammad. Thank you. Thank you for the invitation. Lovely audience here.
Thanks.